Hello everyone. This month, November, is Men's Health Month. Let's use this to increase conversations about men taking care of ourselves and each other. Usually, the Movember movement focuses on health issues like prostate and testicular cancer, but an even more critical issue that we need to talk about is men's mental health. Statistically, one of the things that would most likely take a man's life is himself. Globally, women tend to have higher rates of depression diagnoses and are roughly 3 times more likely to attempt suicide than men. However, men show significantly higher rates of suicide and are 2 to 4 times more likely to die by suicide as compared to women. Suicide is also the leading cause of death in men ages 15 to 29. And part of why male suicide rates are higher is because male suicide methods are often more violent, making them more likely to be completed before anyone can intervene. And so, a problem surrounding men's mental health is that there is this strong social stigma that negatively affects men. So I'm talking about traditional gender roles and masculine ideals that discourage emotional expression and vulnerability among men. Boys are taught since young on how men should behave and portray masculine traits such as strength and bravery and dominance and control. And men are often told to be tough, that it becomes difficult for them to ask for help or seek support when they need it. So they become reluctant to share their feelings and tend to mask their emotions as stress instead of sadness or hopelessness. And so many depression diagnoses in men go underreported. And the truth is, on average, 1 in 8 men will experience depression, and 1 in 5 men will likely experience anxiety at some point in their lives. And yet, the disease tends to be underdiagnosed in men. And the problem may be compounded by the fact that men show a different set of depression symptoms than women. And most research on depression focuses on women more than men. So experts at the National Institute of Mental Health, NIMH, stated that some men with depression hide their emotions and may seem to be angry, irritable, or aggressive, while many women seem sad or express sadness. So other behavioral signs to look out for in men are drinking or taking drugs, being controlling, violent, or showing abusive behavior, and engaging in risky behavior such as drunk driving and so on. And so the experts at NIMH have also studied that men are more likely to see their doctors about physical symptoms such as digestive issues or racing heartbeat or a bad headache rather than emotional symptoms. So look out also for sleep disruption, either insomnia or hypersomnia. So when depression in men are underdiagnosed or underreported, they are more likely to self-treat or self-medicate their symptoms through alcohol or drug dependency as a maladaptive coping strategy. And this can lead to substance abuse. Men are 2 times more likely to meet the diagnostic criteria for alcohol dependence, which is bad because alcohol can deepen depression. So it's also time to re-examine how we deal with domestic violence. Simply vilifying or ostracizing men will not stop the circle of violence until we help men address the root causes of their frustrations. And so to overcome this negative stigma around men's mental health, we must first normalize conversations about it. As a society, we need to be more accepting and open to listen to when our fathers, brothers, uncles, male friends, or colleagues express their feelings. But if the men in your life still choose to remain closed off, try watching for signs of depression based on the symptoms that I've shared earlier. And if you notice any of these symptoms, reach out to that person. Ask him what you can do to help. And we need to be ready to listen and to provide support that they need. And as for men, depression is one of the most common conditions professionals see. And suffering in silence does not make you any more of a hero, nor will it make you seem stronger. So I had to learn this myself the hard way. So if you're experiencing any depression or suicidal symptoms, repeat these words after me. I think I might be depressed. Or, I think I need to seek help. That wasn't so hard, right? Now say it again. And now think of those who you can express these words to, right? It could be someone close, your family, your bros, your doctor, or your therapist, whoever it is. I want you to express those feelings to them today, not tomorrow, not next week, but today. But for some, scheduling a therapy session or opening up to those closest to you can seem daunting. Or perhaps professional treatment might also be out of your reach due to the burden of heavy costs and insurance not providing mental health coverage. But don't worry, thanks to AI and technology, there's a growing pool of mental health resources online that are readily available at your fingertips. So at Naluri, for example, we provide support in different forms to suit different preferences. For those who want to just pick up the phone and speak to a professional, here are our helpline numbers available 24/7. In Malaysia, please call 03-8408-1748. I'll also list numbers for Singapore and Indonesia in the comments below. For those who prefer a digital app to chat with healthcare professionals, you can download Naluri from the App Store or Google Play. And for those who want to see someone, our team is available too. So to all the men watching, don't try to tough it out, because male depression by ourselves can be devastating. Please reach out. Now, more than ever, let's keep things positively personal.